This video will be helpful to you to understand and learn about the different equipments which is used for the medication administration, especially the injections and infusions. I am Jenlyn Bernard, working as nursing tutor in MMM College of Nursing. This video will help the learner to know about the injections and its types, infusions, different equipments used for the injections and infusion. Injection is an act of administering liquid medication into the body by using syringe and needle. There are different types of injections which is classified according to the site where we are administering the medication. Commonly, nurses we used to administer intramuscular injections, subcutaneous injections, intravenous and intradermal injections. Infusion is a method of administering large amount of fluid, including medication, into the bloodstream. A syringe is a simple reciprocating pump consisting different parts which is helping to withdraw or load the medicine from the medication container and to administer or inject into the patient body. The syringe is having different parts. It is called as plunker or pistol, which is tightly fixed into a cylindrical body which is called as barrel, and in the barrel we can see there will be a volume marking, so it can help to measure the amount of medicine which we are injecting into the patient body. Then at the tip there will be a provision to fix the needle to facilitate the injection, and the pistol inside there is a plunker tip which is the one will make the pistol or plunker tightly push the medicine inside the barrel. The syringes can be classified into different sizes according to the amount of medicine can be loaded in it. It can be a 1 ml syringe, 2 or 3 ml syringe, 5, 10, 20, likewise 50 ml syringes. There are two different types of insulin syringes are available. The maximum capacity of the syringe is 1 ml. Here we can see 40 unit syringe and 100 unit syringe. If the medication preparation is 40 units per ml, we have to use the 40 unit syringe. If the medication is prepared as 100 units per ml, then we have to use the 100 unit syringe. Here we can see the 100 unit syringes are available in three different forms, that is 100 units per ml, 50 units per 0.5 ml, 30 units per 0.3 ml. So if we are taking 30 units in which syringe, or it may be a 100 division, 50 division or 30 division, the amount of medication is same. The patients regularly, those who are consuming less than 30 units per injection, can use the 30 unit syringe. Those who are using between 30 to 50 units can use the 50 unit syringe. Those who are using more than 50 units, they have to use the 100 unit syringe. But one basic thing we have to remember, this all three forms are based on the 100 units per ml. Also, the 100 unit syringes are identified as tuberculin syringes. It is commonly used for administering the Mantox test, that is purified protein derivative, and also for the intradermal injections. There are syringes readily available with the loaded medication. Here we can see the medication name, dosage, amount, everything will be labeled in the syringe. It is readily available, just we need to fix the needle and we can inject on the patient according to the dosage is required. Here we can see the pre-filled syringes which is readily available for administration, and the needles also permanently fixed with the syringes. So after single usage this has to be disposed. Here this type of syringes are called as AD syringe or auto disabled syringes. It is very commonly used during the COVID vaccine administration. Once the injection was administered, then the needle will be withdrawn inside the barrel so that it cannot be reused anymore. Insulin injections are readily filled and it is available in the pen form. It is so easy for the patient to do the self administration. The insulin pens are having different parts. The main one is insulin pen and it will be covered with the pen cap. In the pen, in the beginning we can see there will be a insulin reservoir. It is also called as cartridge, and in the front portion it is having a rubber seal. Here it can be attached with the needle. The needle can be changed after each usage or according to the need of the patient, and the needle also having the needle cap so that the sterile technique can be maintained. And when the patient need to take the injection, they can adjust the dosage knob, and this in the dosage window they can view how much dosage they are setting. Once the dosage has been adjusted, the patient will be injecting on themselves and the medicine will be delivered by pressing the injection button. There are different types of syringe tips are available. One is the regular syringe tip. Here we can see the syringe tip is located at the middle or center of the tip of the syringe. Very commonly it is used for all the different types of injections. The next one is coming with the Lewis lock. Here there is a screw type tip is available so that the needles can be fixed firmly, easily. It will not be coming out during the injection procedure. The next one is the eccentric tip. Here the syringe tip will be located at the side of the barrel so that it will be helping or facilitating the administration during the IV medication. So it is more useful to help maintain the ankles. The next one is the catheter tip. This catheter tip syringes can be used for any irrigations, NG tube feeding. And the other one is the Tommy syringe. Tommy syringe also very commonly used during the TURP procedures for the irrigations. Next we can see about the needles. The medicines which is loaded in the syringes will be injected into the patient body through the needles. The needles are having different parts. The first one is hub. This area is helping to attach the needle along with the syringe, and the lengthiest part of the needle is called as shaft, and at the tip of the needle it is called as the bevel. The needles are available in different sizes and it is measured as gauge. When the gauge number is increasing, the size of the needle will be smaller, and when the size, that is the gauge size, is decreasing, the size of the needle will be more. And also here it is matter the length of the needle also. According to the type of injection, the needle size has to be chosen. there are different types of bevels are available in the needle. One is the regular bevel. This regular bevel very commonly we will be using for all kind of injections. It is also called as 3 bevel tip. That is, the cutting edges will be 3 in number. Here we can see 1, 2 and 3. The next one is the short bevel. This short bevel needles will be used to administer the vascular injection, like administering the intravenous injections or withdrawing blood samples from the arteries, because it will be enhancing the complete insertion of the bevel into the blood vessel. Then third one is the intradermal bevel. Again the bevel will be shorter than the short bevel, so very easily the complete bevel will be inserted under the skin. The next one is the 5 bevel. 5 bevel, it is similar like regular bevel, but there will be 5 cutting edges will be there. By this it will be more convenient to administer the injection. There will be less pain perceived by the patient. Because of this 5 cutting tips, it will be very easily inserted and the perception of pain will be very minimal. Then the last one is the blunt tip. This blunt tip needles will be used to dissolve the medication and load the medications from the medication container. Safety needles. In safety needles, there will be a needle guard that will be applied immediately after the injection procedure, so that it is avoiding the risk for getting needle stick injuries. This needle guards are available in different forms. First one, we can see the sliding sheets. Once the injection was given, it is like a barrel type structure which can cover the needle. It has to be pushed upwards, so it will cover the entire needle and we won't develop any needle stick injury after that. Then the second one is the hinged arm, or we can call it as the snap down. It will be like a sheet, just we have to place it or move it in 90 degree and it will be covering the entire needle. Then next one is the retracting needles. After the injection, the needle will be retracted inside the barrel, so that the risk of needle stick injury will be less. In retractable needle, there are 4 steps to handle it. After giving the injection, we have to push the pistol and rotate it in 30 degree, retract the pistol or pull it backwards, and once the needle has gone in, again we have to push it. That will be helping to compress the needle, so that the person will be protected from needle stick injuries. In auto disabled syringes also, the needle will be retracted inside, so that there is no chances for needle stick injury. At this point, I want to insist that all the needles supposed to be used only once, because when we use it for several times, the needle will be blended and it will be causing more pain and tissue injury to the patient. In this picture, we can see the needle before usage, it is very sharp. Just after single usage, you can see the tip become blended, and after 2 usages, again it is more blended. With the 6 times of injection, it is completely bended. But if we see with the naked eye, it will not be much visible, but the patient will be having more pain and tissue injury. To avoid this, remember that we have to use the needles only once. The next equipment is the IV cannula. IV cannula is very commonly used to do the IV infusions, and it is available in different sizes. Like how we have seen in needles, it is measured in gauges. When the gauge of the needle is more, the size of the needle will be smaller. When the smaller gauge needle is taken, it will be bigger in size. It is vary from 14 gauge to 24 gauge, and the size of the needle can be decided according to the patient. Usually the 24 gauge will be used for the newborn babies and the infants, and 22 will be used for pediatric patients and sometimes on adult patient also. But other than this, when we need to administer larger amount of fluid in a shorter duration of time, then we have to select the bigger size of IV cannula, that is maybe 16 or 18 gauge of needle, even the 20. It can be used for the blood transfusion also. The IV cannula is having different parts. One is the metal needle and it is covered with the catheter. Once the needle has entered into the blood vessel, we can able to see the backflow of blood into the flashback chamber. And this flashback chamber is having the connectivity with the lower lock plug. This area, the syringe or IV line, IV tubing will be getting connected. And there is a injection port which is also having the lower connector. During the IV infusion, if any medications has to be given as the bolus dosage or any IV medication can be administered through this port. And there is a needle grip. While we are inserting the needle, it is giving the proper support to position the IV cannula. There is a wings, or we can call it as the catheter hub. This will be helping to attach the IV cannula with the patient body. There is a valve which is allowing the backflow of blood as well as the flow of medication into the body. Scalp vein set. It is available in different sizes and very commonly used for obtaining their blood samples and venipuncture. And very commonly we are using this when a patient is having difficulty to collect the samples. It may be adult, children or even infants. The SV set is having different parts, needle or cannula which is covered by the plastic cap. There are two wings which is providing support for the insertion of needle, and also it will be fixed with the patient body when the procedure has to be done for a longer period of time. And it is continued with the tubing, and at the end it is having a female overlock connector. Here we have to connect the syringe to withdraw the samples, or in case if we are administering medicine also can be done through the SV set. Tourniquet is a device which is added with the velcro material or plastic lock type, which is commonly used over the extremities to occlude the blood vessels, that is to stop or limit the blood flow, which will be facilitating the procedure of IV cannulation. IV tubings are helping to administer a large amount of fluid from the sterile IV fluid containers or from the medications. Also, it is helping to administer the fluid rapidly or in the controlled manner according to the need of the patient. The IV set is having different parts, that is spike which is helping to connect the IV set with the IV bottle or IV bag. There is an air vent port. It is also having a filter within that. It will be facilitating the airflow into the IV solution bottle. Especially it is more useful in the glass bottles. It is continued with the drip chamber. This drip chamber has to be filled half when we are starting the infusion procedure. By that we can able to prevent the entry of air into the tubing throughout the procedure. At the end there will be a solution filter which will filter the solutions which is passing through it. Then the IV tubing is made up of polyvinyl chloride tubing, and it is having a roller clamp. It is helping to regulate the flow rate. And almost at the end of the PVC tubing, it is connected with the rubber tubing. This rubber tubing is the site for administration of any IV injection during the IV infusion, and it is having a connector. This connector will be connected with the IV cannula or needle. Next one is the blood set. Blood set also similar like IV set, but there is a specific difference is that there is a filter which is fixed along with the fluid chamber that will be helping to filter the blood before it is entering into patient body. Here we can see the different parts of the blood transfusion set. It is similar like what we have seen in the IV set. Only the additional thing here you can see the chamber is having the filter. Micro drip set. It is helping to infuse the fluid in a controlled rate from an reservoir. So a small amount of fluid can be administered for a longer duration of time. Here the drop factor will be 60 drops can be made from 1 ml of fluid. The micro drip set is having the different parts. It is more or less similar like the IV tubing. In addition, it is having a volume chamber. So initially the fluid will be allowed to flow into the volume chamber with a particular amount, and the thumb clamp will be locked. So after that the fluid cannot flow into the volume chamber. This fluid from the volume chamber will be permitted to flow into the patient body for a particular period of time. So it is helping to administer the fluid in the maintained pattern, and there is a chamber vein in case any medication has to be added with the IV fluids. It can be added through the chamber vein. Three-way stopcock is a sterile device which will be connected between the IV tubing and the IV cannula, which is facilitating the administration of injection during the IV infusion. Here we can see the arrow mark, 3 different angles it is given. So when we are giving the medication, the arrow which is indicating only in that direction the medication able to flow. When we want to administer along with the IV fluid, the same position can be maintained. But same time when it has been turned into the right angle, only the medicine from the syringe will be flowing inside. After the injection, again the lock can be turned to facilitate the IV infusion. The three-way stopcock also available with the extension tubing, which is helping to avoid the mechanical trauma at the IV site. Here we can see the IV connectors, which is available with the 2-line or 3-line, which is facilitating the multiple drug administration. At the tip we can able to have a splitted septum device, which is facilitating the access to the Lewis lock, or the syringe tip can be attached with that to administer the medication. So there is no need to use the needles, and it is facilitating the closed system of IV line. Here is the stoppers which will be used when the IV infusion is discontinued. This will be connected with the IV cannula. It will be serving the purpose like a lower cap, and also it is preventing the infection. When we need to administer IV injections, with the help of syringe and needle, it can be injected through the rubber band and the medication can be administered to the patient. These are the manual IV regulators. This is helping to regulate the flow of fluid from 5 ml to 250 ml per hour. This is the approximated one. We can administer the fluid in the maintained flow rate. syringe pumps are the electronic motorized device that accurately control the movement of fluid from the syringe, either mechanically inserting the piston inside or retracting the plunker outside. These pumps are used to administer a smaller amount of medication for a longer period of time in a controlled manner. And also it is having the setting to administer the bolus dose of medication in between when it is necessary. These syringe pumps can be fixed along with the IV stand, and also it is facilitated with the battery. So when there is no electricity supply, it can work for a certain period of time through the battery, but the batteries has to be recharged regularly. Infusion pumps are the electronic devices which is helping to administer the fluid in the controlled manner. In this, the larger amount of fluids can be administered. It may be a medication, IV fluids or the nutrients. It is supported with the battery backup and it has to be recharged in the regular manner. This device can be conveniently fixed along with the IV stand. IV stands are used to hang the IV bottles. It is available with a single hook, double hook and also with 4 hook. It can come on the wheels or it can be fixed directly with the cart also. IV bottles are a sterile glass containers which is filled with the sterile medication or IV solutions. During the infusion it cannot collapse, so definitely it needs the air vent. As we are using the air vent, it is having a risk of infection. The plastic IV bottles are prepared with the technology of BFS, that is blowing the container, filling the container and sealing the container. The main aim is preparing and serving the sterile medication. These containers are partially collapsible. The IV bags are prepared with the FFS technology. That is, it will form the bag, it will fill the bag and it will be sealing it. All will be done with one machine. The main aim is preparing and administering the fluids in the more sterile manner. It is completely collapsible bag, so there is no need for any air vent. Throughout the infusion, the closed system can be maintained. Vials are the sterile glass containers having the injectable medicine in the form of powder or liquid. It can be packed as the single dose vial or multi-dose vial. The vials are having different parts. Actually, it is the container made up of glass and it is closed with the rubber cap, and that will be sealed or finished with the aluminium. The bottle will be having the parts like neck, shoulder, body and the bottom. The glass vials will be closed with the rubber cap. We can see the outer side and inner side of the rubber cap. Here there is a circled area. Inside that it is meant for the loading of medication. The reason, in this area the thickness of the rubber cap is very less, so very easily the needle can penetrate in, and this rubber cap will be closed, or we can say sealed with the aluminium, and that also has been protected with the plastic cap. Ampules are the complete sterile and glass containers. It is containing the medications and it will be having only the unit dose system. The ampules are having different parts like head, neck and body. Certain ampules are coming with the colored dot and certain ampules will be given with the cutting line. The colored dots are helping to open the ampules. When the gentle pressure has been given to the opposite direction of the dot, very easily we can able to open the ampule. The ampules can be cut and opened with the ampule cutter. There are different types and varieties of ampule cutters are available in the market. Plastic ampules also used to fill the sterile medications or the sterile water. It can be opened very easily by twisting the head of the ampule. We can load the medication. Whenever performing injections and infusion procedures, remember to have the sharp containers with you, because it will be facilitating the immediate disposal of the sharp items. By that we can able to prevent the sharp injuries. In injection and infusion procedures, as we are handling with the sharp items, there is a risk for getting needle stick injuries. So always take caution to prevent the needle stick injury. Since the injection and infusion procedures have a chance to get contact with the body fluid, always remember to follow the infection control measures like wearing the glove. In this video, we have learned about the different types of equipments which can be used for the injections and infusion procedures. The references are taken from the Nursing Foundation textbooks and also from the internet. Hope this video will be useful to you. Thank you for watching.